November 2nd, Monday, November 2nd, 5:39. This is time and place for the City Commission meeting of City of Huron. Roll call, please.
Smith.
Aye.
Clute.
Aye.
Bragg.
Aye.
Robish.
Present.
Mayor Harrington.
Aye. Join me in a pledge of allegiance. I pledge allegiance to the flag
of the United States of America.
And to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Agenda approval. I have some,
Public forum first.
pardon me?
Public forum.
Public forum, yep, that's what I said, public forum. Public forum, public comments may be sent during the live meeting broadcast to the city's YouTube channel. This link is listed on the city's website at www.hursd.com/citygovernment. In order to use the YouTube chat feature, please create an account with the YouTube and Gmail or using your existing accounts. Please state your name and address for the record. Public forum is limited to the maximum of 3 minutes per person. We also have Kevin sitting on our phone tonight, so if you have questions, you can send it in through that YouTube or Gmail, and Kevin will get the questions to us, and we'll hopefully can answer them from at this time. And at this time, if there's anybody that wants to speak to a public forum, and I believe Commissioner Clute has a public forum message tonight. So, Doug?
Thank you, Mayor. Last week, the Solid Waste Department announced that this Friday would be the last day for the green container pickup. We've heard a lot of complaints about that, or requests really from the public that be extended. And so we're going to extend that one more week. So a week from Friday will be the last pickup. So you will have 2 more pickups of the green containers, so everybody can try to get their lawns cleaned up by then. The reason we end it is when it gets really cold, the wet leaves freeze in that green container, and they really is very difficult for them to get those out of the green container without damaging the container. So I would say this is probably the last extension we'll have, but we'll see.
All right, thank you. Now, agenda approval. I have an amendment to the agenda. It's going to be 8.1. This is task force update and a weekly case count update. We seem to have a lot of amendments to our agenda each week, but this one here definitely was my fault. I didn't have it down in time, and so I had to amend the agenda. So with that, if there's any questions on that?
I'd like to move to approve the agenda as amended.
Move to approve the agenda. Yes, second?
Second.
Okay. I need a roll call vote on that, please.
Smith.
Aye.
Clute.
Aye.
Bragg.
Aye.
Robish.
Aye.
Mayor Harrington.
Aye. Item number 4, consent agenda. Matters appearing on the consent agenda are expected to be non-controversial and will be acted upon by the commission at one time without discussion. Unless a member of the commission requests an opportunity to address any given item, items removed from the consent agenda will be discussed at the beginning of the formal items. Tonight's consent agenda 4.1, minutes of October 26, 2020, commission meeting. 4.2, fuel quotes for city departments. 4.3, payment of the bills. I entertain a motion to approve the consent agenda.
Move approval of the consent agenda.
Commissioner Clute with the move approval. Need a second?
Second.
Second, Smith.
Second, Commissioner Robish. Roll call. Any discussion on this? None. We'll have roll call, please.
Smith.
Aye.
Clute.
Aye.
Bragg.
Aye.
Robish.
Aye.
Mayor Harrington.
Aye. Bid quote items. 5.1, consider payment number 4 by Midland Contracting Incorporated for bid number 2020-11, Southtown Residential Development Street and Utility Improvements in the amount of $341,084.58. Assistant Engineer Dennis Bennett, would you speak on that?
Do I need to come up to the podium or?
Yes, please come to the podium. We'd love to see your face.
The mask is too high in here. This is a payment to the Southtown area. It's pretty much done out there. All the asphalt's in, got a couple sidewalk ramps to pour and black dirt. And that project will be done. But this is just a progress payment on that project. Recommend approval.
Do we have a motion on this?
Move to approve.
Motion, Smith.
Okay. Mr. Roberts moves for the second.
Second, Smith.
Second by Commissioner Smith. Discussion on this. Any questions? No questions? Roll call vote, please.
Smith.
Aye.
Clute.
Aye.
Bragg.
Aye.
Robish.
Aye.
Mayor Harrington.
Aye. 5.2, consider payment number 5 to Midland Contracting Incorporated, bid number 2018-12, 3rd Street Southwest, West Park to Union, in the amount of $82,700.33. Assistant Bennett, Engineer Dennis Bennett, please.
Mayor, this is just a progress payment on 3rd Street from Union to West Park. Today, the asphalt got laid there, so that the black dirt needs shaped up and seeded, and we're done with that project. But this is just progress payment, recommend approval.
Okay. Do I have a motion?
Move approval. Excuse me.
Commissioner Clute, move approval. Second by Commissioner Robish. Discussion. Any discussion? Commissioner Robish.
Thank you, Mayor. Dennis, we just went to Union, we're not going any further east at all?
Not at this time. We got a project that's, will be bid next year maybe,
Oh,
for 3rd Street from Pennington to where we stopped.
okay.
Yep, and that will complete that phase of road construction up
I
there.
was thinking we were gonna go just a little further, but that's okay.
Yep, we're in landowner talks right now on that
Oh.
project, so.
All right, I got you. Thank you.
Yep, no problem, thank you.
Any other discussion? Roll call vote, please.
Smith.
Aye.
Clute.
Aye.
Bragg.
Aye.
Robish.
Aye.
Mayor Harrington.
Aye. Petitions and communications. 6.1, consider professional services agreement with HR Green for water model update. Assistant Engineer Dennis Bennett.
Thank you again, Mayor. This is just asking for approval to get this water model update going. We do it periodically. We went with HR Green on this because they did the previous ones. So they have a lot of legwork done already, and it saves us money that way. So we're asking for approval. This will not be bid until paid until 21. But we just want to get it in process now, so when we do our plans for next year and stuff, that we take into account anything they bring up. Recommend approval.
Need a motion?
Move to approve.
Move to approve. Commissioner Bragg, need a second.
Second, Smith.
Second, Commissioner Smith. Any discussion on this topic? Yes, Commissioner Roberts.
Thank you, Mayor. And Dennis, I'm just throwing this out there because this is a big project. With HR Green, we're gonna have a big project for the next how many years?
HR Green,
Well, I understand with our sewer and our water, and it's kind of all, that's why we're using them?
this is for the water flow only, this study,
Okay.
and we had 18,000 budgeted, came in 17,900.
Okay.
But like at the beef complex fire, the water pressure there was an issue, I guess. And this is to address things like that, hopefully find them and get them taken care of before they surface.
And that's
So-
okay, I was thinking it was part of our new water and sewer project, and it's like, we're always putting this stuff into place, and then when it comes right down to it, we always repeat.
Yep,
But
and
that's
this,
okay.
they're gonna tell us if we need a 6-inch, 12-inch, 8-inch, whatever in the areas. And that's what this will do, so we don't undersize or oversize and
That's my
cost
understanding.
extra money or starve for water.
I thought it was part of our ongoing.
And fringes, yeah.
Yeah, okay. Well,
They're all tied together.
That's good, thank you.
Yep.
Any other discussion? Seeing none, we entertain a motion?
I have a motion and a second.
We do? We're gonna have a roll call vote then.
Smith.
Aye.
Clute.
Aye.
Craig.
Aye.
Robish.
Aye.
Mayor Harrington.
Aye. Okay, 7.1, public hearing and second reading of ordinance number 2017-23-403, zoning accessory buildings and structures. City Attorney Tucker Valesky, would you speak on this, please?
Thank you, Mayor. Yes, and I would just reiterate from last week's discussion that this ordinance just expands the areas for which the corrugated sheet metal siding is allowed for walls and roofs. And that's in light of the variance requests the commission has received from these areas of issue.
A motion on this?
Motion to approve second reading.
Motion approved. Commissioner Smith, need a second?
Second.
Second, Commissioner Clute. Any discussion on this? Seeing none, roll call vote, please.
Smith.
Aye.
Clute.
Aye.
Craig.
Aye.
Robish.
Aye.
Mayor Harrington.
Aye. Departmental items, 8.1, task force update. Commissioner Smith is going to give us an update on our weekly update on our task force. So Commissioner Smith, if you would do that, I'd appreciate it.
Thank you, Mayor. Yes, we've met a number of times throughout the week as either a unified task force or departments within the task force have met independently. Some of the updates that I can bring forward to you, the overwhelming conversation out there is just a public awareness for asking the public to mask up when they're out in public areas and unable to socially distance. The task force did host a public meeting on Wednesday night, public, not so public. We broadcast that on YouTube. That public meeting was received very well within the community. It is available for viewing on the Beetle County COVID-19 website. There are you can watch it in its entirety, and also pieces of it based on the speakers that you'd like to listen to. Some of the comments that I heard about it was people did not view it because they just felt it'd be the same old information, so to speak, that was put out by the officials. But the people that responded to that also said, you should watch it because it really brought it down to a local level and identified some of the close to home issues that we're dealing with in Beetle County, along with the surrounding counties. The thing that kind of hit me the most on it was Eric Larson's conversation about how this disease is, they have the availability for building to take on about, I believe it's around 30 patients for COVID. The problem, the challenge is trying to keep the healthcare workers, not burning out the healthcare workers, trying to keep the healthcare workers available to watch over the patients. They're working diligently 24/7, and Those are things that I get a little concerned that people don't think about how this disease is not just affecting a certain few with the disease, but it transfers onto the workload of other people that are healthy and able to care for people. And it hit close to home for me, his testimony on that. So if you get a chance, jump onto Beetle County COVID-19 website, and you can go to the links for that viewing of that Wednesday night meeting. There, throughout the week, and maybe Barry, if you can share your screen, we'll bring up the weekly changes of COVID-19 in Beetle County that we track. So on this screen, starting on the left would be the numbers reported on the 27th of October, and then you can follow that to the right to today's numbers being reported. As you can see, the blue are new cases, the gray line is new recoveries, and we started out at 2, and as that increased up to 50 on the 29th, and has kind of been bouncing between 50 and the latest high number was 47 on the 1st of November. Some of that lag between the 27th and 28th reporting had to do with the test results and the availability of the testing materials. So there was a bit of a lag in the reporting of that. You can also see the new recoveries as you go from left to right. There's a good spike there on the 1st of November at 62. That was also attributed to some reporting activity that we had seen. So it's not an exact science, but it gives you a very good idea of how active COVID is in Beetle County. And when you start seeing those kinds of numbers, double digit up to 50 in one day reporting, I'd probably rely more on the 34 to 47 number because of the testing lag. But that's got to be alarming to people. I don't know how else to put it. When COVID started, when we started working with it and dealing with it, we were very concerned about one case, and now we're working with 213, 277 active cases. I'm looking at the chart wrong, I apologize. 363 total active cases as of today. I know in my day job, so to speak, it's affecting our employees. It may not be affecting them directly as a carrier, but it is affecting them with living with people that may be a carrier, or someone like myself who has been quarantined as a close contact. So the virus is real. It is having an effect in our county, and we're at the highest levels we've been throughout this period of COVID. Again, masks are being asking the public to wear masks. People have different opinions on whether they work or whether they don't. I just feel that whether they work or whether they don't, wear a mask. It's the least that we can do, not only to protect other people, but also try to flatten the curve as we started again on this. I did want to touch on the hospital. The hospital is reporting four patients, one in ICU and one on a vent. Eric Larson, who is the CEO of the hospital, did clarify that, because we do get some questions on how come that doesn't move around very much. And what happens is the net number doesn't move around very much, but what makes up that net number moves around daily. People coming in, people leaving. So those four that are in the hospital or reporting to be in the hospital are not the same four every day. It's just the net number stays rather static at between 4 to 6. One other point to bring up is concerning local voting tomorrow. Get out and vote if you can. If you haven't ran a ballot through mail or absentee, the voting area will be recommending and requesting masks to be worn. They will be practicing high levels of COVID precautions for that process. And again, that's the protection of the voters as well as the workers that are facilitating that. Our next task force meeting is tomorrow. We meet every Tuesday, and that's it for this edition.
Thank you, Brian. Appreciate that. That is something that we've decided we're going to add to each Monday night commission meeting, is an update on the task force and numbers, just to give you some idea of where we are in our community as far as the virus. So hopefully that's appreciated. We certainly look forward to providing that information to you that each week. So thank you, Brian. Appreciate that. Good report. And so with that, now we're going to go into a work session. So